Hello, my name is Narmin Karimova, and today I'm gonna talk about Heartflow FFTct analysis in detecting coronary artery diseases. First of all, I would like to start from introduction. Coronary artery diseases. Coronary artery disease or coronary artery disorder, it means the same meaning. You can use both of these words. It is one of the main reasons of death in United States. In 1 in 7 deaths in United States is due to coronary artery diseases. Coronary artery diseases is one of the most expensive diseases treated in United States. It's about $6 billion. And this disease usually occurs in old age group, but it can also can happen in young age group also. But usually it occurs in age group 65 or older. This time and diagnosing in coronary artery diseases is very important, because if they are detected in time, it can save lives. And heart flow analysis, which I'm going to talk later, is the non-invasive method and novel method in detecting coronary artery diseases. Coronary arteries. What arteries are they? Coronary arteries are the main arteries of the heart muscle. There are two main coronary arteries, right coronary artery, as you can see on the photo, and left coronary artery. There is also left circumflex artery, which is also main artery of the heart muscle, and it's considered the branch of left coronary artery. Why these arteries are so important? Since these arteries supply blood to the heart muscle, means that they also supply oxygen, nutrients, this heart muscle. So any disease, any disorder which affects these coronary arteries can lead to a malfunction of the heart muscle. So it's very important to detect these coronary artery diseases in time, which can also save our heart muscle. If we treat these diseases, the heart will function properly. So, what is the main cause of coronary artery disorder? The main cause of coronary artery disorder is atherosclerosis. What is atherosclerosis? Atherosclerosis is building up fat cholesterol on the wall of the blood vessels. This process doesn't happen in one day or in 1 week or in 1 month. It takes time. It happens eventually. It takes years to build up fat deposits on the wall of the blood vessel. Here is image of healthy artery in my first image. In the second image, in this yellow, you can see little fatty deposits on the wall of the blood vessel. Eventually, we have more fatty deposits on the wall of blood vessel. When it grows more and more, it can obstruct the blood flow in the vessel. So in the last image, you can see there's almost nearly complete blockage of the blood vessel. So what happens if there is complete blockage of the blood vessel? If there is complete blockage of the blood vessel, it means that that area of the heart muscle doesn't get enough blood supply. It doesn't get enough oxygen and nutrients. If cells don't get oxygen, they die, what is called necrosis. And of course, it will lead myocardial infarction, and of course, the patient will have heart attack, which is very, very serious condition, because it can cause death of patient. There are 3 manifestations of coronary artery diseases. The first one, stable angina. Second one, acute coronary syndrome. And the last one is heart attack. This manifestation depends how these arteries are diseased. So depending on how the arteries are diseased, they give this manifestation. I would like first to talk about stable angina. Angina means rest, angina means pain. So stable angina is also called stable coronary syndrome. What happens? Usually when the patient is emotionally or physically stressed, he or she is having a pain. This pain can be on upper chest area, or if you can see on the photo, it can radiate to neck, jaw, it can radiate to left shoulder, left arm. Sometimes patients even don't understand that this pain is due to their heart. They think that something else causes pain, because sometimes they can have the pain even in epigastric area. If the patient realizes that this is due to their heart muscle, if they take rest, then the pain goes away. Or there is specific medication which is called nitroglycerin. If they put nitroglycerin under their tongue, the pain is relieved. So that's why it's called stable angina. The second manifestation is called acute coronary syndrome, or defined is as a rest angina. Why it's called rest angina? Means that the patient has a pain not only emotionally or physically stressed, the patient gets the pain during even the rest. The patient can wake up in the middle of the night because of the pain. And of course, still the pain usually in the upper chest area, or it can feel as a discomfort on that area. The patient can have difficulty of breathing due to the pain. He or she can have cold sweating. It can also cause nausea and vomiting. At last, the last stage of coronary artery diseases is heart attack. This is ultimate stage of coronary artery disease. It's a very, very serious condition. Why it happens? Because there is complete blockage of coronary artery, and that area doesn't get any blood supply. Patient has very, very high level of pain. Sometimes they describe the pain as an elephant sitting on their chest. They feel like huge pressure on their chest area. They have lack of shortness of breath. They can have cold sweating. They can have nausea and vomiting. If the patient doesn't get any medical help, he or she can die. That's why it is very serious, and the patient must get treated if they have coronary artery diseases. What are the risk factors of coronary artery diseases? The risk factors which causes coronary artery disease, which leads to coronary artery diseases, can be divided in primary and secondary. The primary one of them is old age. As I told before, the coronary artery diseases usually happens in old age group, in age group over 65 years old. So this is one of the primary risk factors for the coronary artery diseases. The second risk factor can be smoking. We know that tobacco can cause some changes on the walls of the blood vessel, which can also lead to coronary artery disorders. The other one, of course, is obesity, because fat, cholesterol is the main part of the plaque of atherosclerosis, which causes obstruction in blood vessel. So obesity, another one of the main risk factors of coronary artery disorder. At last, the other one is high blood pressure. When we talk about high blood pressure, we just don't talk about high blood pressure which happens only once. We are talking about chronic high blood pressure, because if it's chronic, if you usually have high blood pressure, it leads to some changes in blood vessels, it leads to the obstruction, of course it leads to the coronary artery disorders. The secondary risk factors, these are risk factors, they can lead to the coronary artery disease or not. So one of them is heavy alcohol use, and another one is certain autoimmune diseases, because not all the autoimmune diseases can cause coronary artery disorder. There are certain type of autoimmune diseases that can cause coronary artery disorders. Okay, how we diagnose coronary artery disorders? Diagnosis of coronary artery disorders, there are two methods. One of them invasive, another method is non-invasive method. In my next slides, I'm going to talk about this method. One of them is computer tomography angiography. This is non-invasive method in detecting coronary artery disorders. This is actually a good method in detecting coronary artery disorders. You can see this is the image of getting left anterior descending artery, and this method can show us where the obstruction is located, but it doesn't show how this obstruction, how this plaque affects the blood flow. This is the limitation of this method. It doesn't give us accuracy how it affects. So doctor cannot decide if the patient needs a surgery or patient can be fine just taking some medicine. This is the limitation of this method. Another method, which is called invasive coronary angiography, is actually considered gold standard in detecting coronary artery disorders. From the name, as you see, it is invasive method, which is the limitation of this method. But it is very good method because it shows the location, as you can see from the image, and at the same time it shows how this obstruction affects the blood flow. So the doctors can decide which the patient needs a surgery immediately, or the patient can be just fine with taking some medicine. That's why it is considered gold standard method, but the limitation is that it is invasive. Other method, it is stress echo test, which is combination of treadmill and echocardiography. It is considered non-invasive method. The other one is single photon emission computed tomography. It is this method. In this method, they administer radioactive tracer which goes to the coronary arteries, and when they track this tracer, they can see where the obstruction is located. But the limitation of this method is that it has very low sensitivity. This is the limitation of this method. Another method is electrocardiogram. It is based on electrical activity of the heart muscle. And the last non-invasive method is echocardiogram. Echocardiogram, it is ultrasound of the heart muscle. It actually doesn't give us direct information about coronary artery disorders, but when they see the heart doesn't function properly, has some malfunction, so they can have some idea that something can go on with coronary artery, so they can do more tests and decide what's going on with the blood flow in coronary artery. So all these methods are detecting coronary artery diseases. The method what I'm going to talk, it is Heartflow FFTct analysis. It is non-invasive method, and it is new technology in detecting coronary artery diseases. Okay, here comes question, how it works. Actually, it is based in computer tomography. When patient comes, you take him to the computer tomography, you do a computer tomography angiography, and you get the 2D images of coronary arteries, and also you can get 3D images of coronary artery. These images is only anatomical image of coronary artery because it just shows you coronary arteries and where is the obstruction. It doesn't give you any information about physiology. It doesn't give you how this obstruction affects the blood flow, what's going on with blood flow. The next step is that they send these images to the specialists. What the specialists do, they add computational fluid dynamics on these images. Computational fluid dynamic is actually very complex method. When they add computational fluid dynamics, it gives you a result, it gives you information about blood flow, how these obstructions affect the blood flow, if this obstruction is lesion specific obstruction. Okay, and the result comes in 3D color images. They call it color-coded 3D mesh image of FFTct. All these numbers all are very important. Every time when we talk about Heartflow, we mention Heartflow FFTct. So you can have a question, what is FFR? What does FFR mean? FFR is fractional flow reverse. It shows you the ratio between the maximum blood flow on diseased coronary artery and healthy coronary artery. So if FFR is equal to 1, means that there is 100% of blood flow in coronary arteries. Coronary arteries are healthy, nothing is going on. But if it is less than 1, means that something going on coronary arteries that affect this blood flow. Like 0.9 means there's 90% blood flow in coronary artery, in that area, diseased area of coronary arteries. When they do invasive coronary angiography, they measure FFR with invasive method. But in Heartflow analysis, it is based on CT images, CT computer tomography angiography image. When they add computational fluid dynamics, they get information about FFR. Computational fluid dynamics gives the results of FFR. That's why Heartflow analysis is non-invasive method. Here is the images of coronary artery. They call it private coronary artery because for each patient they get specific private image of coronary arteries. You can see different colors. Colors are not important. You can choose any color. What are important here are these numbers on the left side, because this number are designated to this color. So this number shows how this obstruction is affected the blood flow. As I told before, 1 is perfect, meaning nothing going on, but less than 1 is important, specifically if it is FFRCT less than 0.8 is very significant. Why? Because it means that this obstruction leads lesion-specific ischemia. That's why by looking at these numbers, the doctors can determine how this obstruction affects the blood flow and how this blood flow affects the heart muscle, what's going on with heart muscle. Here I would like to talk about one patient who was about 65-year-old man, come to the hospital. He's having a pain. They did computer tomography angiography. On the first image you can see plaque on the left descending artery. They did Heartflow analysis on image B, the result, and invasive coronary angiography, image C. As you can see, in both images, the results are the same, almost the same, 0.76 in Heartflow FFR analysis and 0.75 in coronary invasive coronary angiography. Another one is a lady, 57-year-old. She comes to the hospital. She's also having chest pain. When they did computer tomography angiography, they see plaque also in the left descending artery. They did coronary angiography and also they did Heartflow FFRCT analysis. As you can see, the results are the same, 0.70 in Heartflow FFRCT analysis and 0.71 invasive coronary angiography. So if this result coming from non-invasive method and invasive methods are the same, why not to use non-invasive method instead of invasive method? So, Heartflow analysis, it is not just diagnostic method. It is also gives some treatment plan for the patient. Actually, by looking at this 3D color image, the doctor can determine their future treatment plan for their patient. If the patient needs stent, if the patient needs bypass surgery, or the patient needs medicines. So it is very good method that doctors can use to determine their treatment plan. Here are the advantages. Of course, it is avoidance of unnecessary invasive coronary angiography method in almost 61%. So patients, if they don't need, they avoid all these unnecessary invasive methods. The second one, as I showed before, it has very high diagnostic performance. The result almost the same with invasive coronary angiography. The second, it has reduced cost and improved outcomes. And the last one, it is a very good guidance. so the doctors can make their own treatment plan for their patients. Of course, every method has its own limitations. And one of the limitations of Heartflow FFTct analysis is that it is very susceptible to image quality. When we talk about image quality, we are talking about CTA image quality, because 20% of CT images are not suitable for Heartflow analysis. So that's one of the limitations of this method. The second limitation is that it's not suitable for emergency cases, because the result doesn't come immediately. It takes hours to get the result. Sometimes it can even take 24 hours to get the result. That's why it is not very suitable in emergency cases. The last limitation is that radiation exposure. How? Because it is based on computer tomography images. Patient needs to have computer tomography angiography to get Heartflow analysis results. That's why the patient gets radiation exposure, which is another limitation of this method. In conclusion, I would like to say that it has a very growing acceptance, not only in United States, also in Europe, Japan, Canada. Another one is that it is one of the best non-invasive methods in detecting coronary artery diseases comparing with other non-invasive methods. And the last one is that it has continuous improvement. Right now, specialists are working on this method because they won't use it in emergency situation. That's why they are trying to reduce these hours to get the results. Here are my references, and of course, thank you for your attention.